If you're considering cataract surgery, you may have heard that there are two different ways a procedure can be performed: traditional cataract surgery and laser-assisted cataract surgery. Both procedures can provide excellent results, but there are some important differences in how the surgery is performed. In this video, I'll show you exactly what those differences are and why your surgeon may recommend one approach over the other. To refresh your memory, cataract surgery is lens replacement surgery. Remember that a cataract is a cloudy lens inside of your eye. To improve your vision and keep it from declining and leading to blindness, cataract surgery is performed to remove the cloudy lens and replace it with a clear artificial lens implant. To remove the cloudy lens inside of the eye, we need to make certain incisions in the eye. First, we need to make an incision to enter the eye. Then, we need to make a circular opening into the lens. And finally, we need to cut the cloudy contents of the lens into small pieces that can be effectively melted with ultrasound and removed from the eye. Well, these incisions can now be made in two different ways: by laser or by blade. At Anaheim Eye, we have been using the LensX laser system since its FDA approval in 2012 because it offers certain advantages that we do not have when performing surgery manually with blades. One of the primary reasons we adopted laser technology was the added level of safety it provides. During lens replacement surgery, we have to make extremely precise incisions inside of the eye. The eye is a very small and delicate space, so even an unexpected movement by the patient can make these steps more challenging and increase the risk of complications. The laser helped us address this concern by introducing a gentle suction device that securely holds the eye in position during this critical portion of the procedure. This helps prevent accidental eye movement, while the laser creates the incisions with extraordinary precision. For us, that added stability, control, and precision was one of the most important reasons we transitioned from performing these steps manually to using laser technology. Another very important reason we prefer to use a laser for lens replacement surgery is the extraordinary accuracy it provides when creating incisions. Before the laser makes an incision, it first measures and maps the structures of your eye. This allows us to determine the thickness of the tissue and precisely plan where each incision should be made and exactly how deep it should go. This is important because we want every incision to be deep enough to accomplish its purpose, but not deeper than necessary. The laser also gives Dr. Neil complete control over the surgical plan before any incision is made. He can customize a number of incisions, their exact location, their size, and their depth based specifically on the anatomy of your eye. Once Dr. Neil is satisfied with the plan, the laser carries out those incisions with a level of precision and consistency that would be extremely difficult to reproduce by hand. So rather than simply making an incision and judging its depth manually, we are able to measure first, plan first, and then use the laser to precisely carry out that plan. As we were describing, there are two different ways to perform lens replacement surgery. It can be performed either manually, using handheld instruments, or with the assistance of a laser. Insurance companies refer to the manual method as standard cataract surgery. With standard cataract surgery, the surgeon creates the necessary incisions by hand using small surgical instruments. With laser cataract surgery, many of these important steps are instead performed using this advanced laser. At Anaheim Eye, we continue to offer both methods. The reason is that insurance companies do not cover the additional cost of using a laser for cataract surgery. They consider the laser to be an elective upgrade, so that additional cost is the patient's responsibility. Because we never want costs to prevent someone from having necessary cataract surgery, we continue to offer traditional manual surgery as well. Here is how the manual method is performed. First, we use a small surgical scalpel to make an incision and enter the eye. Next, we use handheld forceps to manually create a circular opening in the thin membrane that surrounds the cataract lens. We then use another handheld instrument to break the cataract into smaller pieces. Finally, an ultrasound instrument is placed inside the eye to break down and remove those pieces of the cataract. As you can see, with standard cataract surgery, these important steps are performed manually by the surgeon using handheld instruments inside the eye. Now let's put the two methods side by side so you can see exactly how they differ. On the left is the laser method. On the right is the traditional blade method. The first step is creating an incision to enter the eye. With the laser method, the eye is gently held in place so that it cannot accidentally move. The laser identifies and marks exactly where we want the incision to be, and then creates that incision using laser light. With the traditional method, the surgeon creates the incision manually using the small scalpel you see here. The next step is one of the most important parts of the entire procedure. We need to create a perfectly positioned circular opening in the front of the cataract so that we can reach the cloudy lens material inside. But this opening does more than simply give us access to the cataract. The edge of this opening ultimately helps hold and position the new artificial lens inside the eye. With the laser method, the eye remains held in place, while the laser measures the eye and allows us to plan the size, shape, and position of this opening before it is made. The opening is then created precisely using laser light. With the standard method, the surgeon creates this circular opening manually using handheld forceps, carefully tearing the thin membrane around the cataract by hand. This can be very challenging to perform and is where the eye needs to be completely still for it to be done accurately. Finally, we need to break apart the cloudy cataract so that it can be removed from the eye. With the laser method, laser light is used to divide the cataract into smaller pieces before we remove it. With the traditional method, the surgeon divides the cataract manually using surgical instruments inside the eye. After the cataract has been divided, ultrasound is used to break down and remove the remaining cloudy lens material from the eye. So both techniques are designed to accomplish the same thing: remove the cloudy natural lens and replace it with a clear artificial lens. The major difference is how we perform these critical steps. With traditional surgery, these steps are performed manually using handheld instruments inside the eye. With laser surgery, we are able to stabilize the eye, carefully plan the treatment before making our incisions, and use laser light to perform several of the most important steps with an extremely high degree of precision and consistency. For us, that represents an important advancement in the way lens replacement surgery can be performed. Whenever we have the opportunity to reduce our reliance on handheld instruments and use technology to help us control the size, location, and depth of our incisions, we believe that provides meaningful advantages during the procedure. That is why, at Anaheim Eye, we recommend the laser option to our patients whenever it's financially feasible for them. Unfortunately, insurance considers the laser an elective upgrade and does not cover its additional cost, so ultimately the decision is yours. Whichever method you choose, our goal remains exactly the same: to perform your surgery as carefully and precisely as possible and give you the best vision we can.